Hi, I'm Enchanting Nubianette. Welcome back. And if you're new to my channel, welcome. Everyone, I was so flabbergasted when I saw this headline. Can't you believe? I couldn't believe it. But here it goes. China has the world's first AI hospital. So, in Tsinghua, I'm not sure if I'm pronouncing it correctly, it's Tsinghua. Tsinghua University, their project replaces the traditional clinical workflow with intelligent software agents. It started this month, everyone. The system is known as the Tsinghua AI Agent Hospital, and it was inaugurated on April 26, but they started just on the 15th, just yesterday. So in the Tsinghua's main campus in Beijing, it's marking a milestone in the country's push to industrialize medical AI. Here we go. China is really forceful and they're forward. Unlike a conventional brick and mortar hospital, this Tsinhua's project is primarily run on software. So there's autonomous AI doctors and nurse agents all over the place. Just imagine, that is truly what the future should look like. And I can see that we're really way behind. So in a hospital, you'll see like these virtual patients in a simulated clinical environment. And this model is designed to learn and improve with each case. So of course, it's brand new and it's really setting the pace so that researchers and medical students can test real scenarios safely even before touching a real patient. Now, I really love that that protocol because they need to have a trial period first with these AI agents. It's just smart, and of course, for insurance purposes and safety. No one wants to be held accountable for any mishaps or any issues with the robots itself. So there have been early technical write-ups that have said that the system first launched 14 AI doctor agents and 4 AI nursing agents. So that was in the beginning, and now it has expanded to 21 specialties. And many supporters say that the agents, everything have been going so well, thankfully, that they have passed all the diagnostic benchmarks. So let's talk more in depth about the hospital. So the agent hospital is a full hospital operating system. The agents there, they take the histories of these patients, they order their tests, and we know the tests are tailor-made for every person. Every person is unique. They have different issues when going to the hospital, different medical reasons. These agents, they make differential diagnoses. They also generate treatment plans, once again, tailored for every specific person, and they schedule follow ups. So at first, they had synthetic patients, so the agents could be trained and audited. And now, of course, they're working with their real life people. So the university says that the program is part of a broader effort to rethink how hospitals are designed and run. So with these intelligent agents, they're at the core of operations. So the virtual first design is very important because this is how the fully AI run hospital will be. So the system right now is not a public hospital where people walk in. to be treated exclusively by these algorithms. It's a research and training platform. So it's now little by little increasing and increasing the feeding the information to the pilots inside the real hospitals. And that's where the AI agents and the service robots will assist human clinicians and staff. This is so incredible. I am so fascinated by this, everyone. So let's find out more about where the robots come in. So as China has been leading AI number one in the world with everything they do. From people who have been there, the videos I have seen, they have such innovative aspects. I mean, to their homes, of course, businesses, and now hospitals, even more so. So during the pandemic, this started everyone I shouldn't even say the word, during 2020, Beijing and the Wuhan facilities, they ran robot staffed isolation wards. And we know wards hold so many people, and we know China has like the number two largest population in the world after Africa. So again, during 2020, these robots, they delivered meals, medications, they measured temperatures, they disinfected rooms, and it definitely helped to keep the real life clinicians safe from exposure from the virus at that time. So these trials did help normalize the idea in everyone's mindset, just being, seeing them up front and center, and even the staff. It helped normalize the idea of robots performing routine, patient facing tasks on the wards. So now, present day, the hospitals are linked to major universities and they have focused on that same pilot program. So now, case studies and conference materials from Chinese facilities, they show the automated supplies, the packaging, and the transfer of robots. They have now taken over sterilization department, logistics, behind the scenes automation, and it helps to make the care and the services possible. And there are other centers also that are trailing the 5G connected surgical robots. So that's another aspect, another level where people who need, I'm sure, like more minor surgery, they will have robots assisting them. And of course, the areas will be carefully controlled and there will be ultra remote procedures where there will be someone who's supervising all the time. So again, these robots, these service robots, they're closer to the patients. They're now guiding visitors. They're escorting them to imaging, for example, perhaps if they need maybe a PET scan, MRI scan, and so forth. They have medications provided to their bedside by these AI agents. And of course, a pro, of course, with all the work that they do, it's freeing up the time and energy from the clerks, the doctors, and the nurses, so that the people who need even more care, who have even more severe um, medical issues, will get that high value care. I think that's superb. As long as all of these AI agents, robots are supervised, and I mean, someone must be there every second of the day viewing exactly what they're doing and making sure that everything flows well. So in the Shenzhen's health system, there's reports of hundreds of AI enabled products in active use. So there are spanning diagnostics, there's ward management, patient services, and so much more. So, what does it look like on a daily basis? So the pilot program is like this, where a patient would open up the hospital app. In the app, they'll place their symptoms, what they think they may have, the issue, or just what they're experiencing. An AI triage agent will assign the risk and they recommend tests for the person. And if it's a low acuity case where it's something minor, for example, the patient is given a time window for a kiosk visit. But if anything looks more severe, um, very risky, a human clinician is going to be put onto that case immediately. That's excellent to hear. And again, the supervision. This is exactly what we need, accountability. So at the hospital, a lobby robot will greet the patient, guide them to get their vitals. We know that's, your temperature, maybe your blood pressure, the EKG, height and weight, for example. There's also a med delivery bot. This is so sophisticated that brings prescribed medication to the bedside of the person when they're, you know, checked in at the hospital or even at a pickup point. So, from what I'm seeing on the article, everyone, it says that, they have had bots in these Chinese hospitals once again since 2020. And it has just been more um, innovated and more modern. So they have been tweaking it, making sure that it's gotten even better. So the AI agents even draft notes, they suggest orders and patient instructions, and the human doctor signs off. The human doctor edits anything the AI robots do and any overrides that's needed. That's their call. So the AI collaborative physician model, the Chinese regulators and legal analysis say are working hand in hand. Excellent. So why is China doing this? We know that, as I mentioned before, that China has a humongous population, the second most highest population. So China's healthcare system faces a well-documented strain. There's a lot of elderly people in China. So they have to treat, of course, the aging population, and there is not a huge amount of specialists and people who are specialized in outpatient volumes. And we know there's a lot of people from China who have, moved to other countries. They're well educated and they chose to work and live in another country. So a lot of policymakers and hospital leaders argue that agentic AI plus robots can expand standardized routine care and create more face time for human clinicians in the areas of high need. And the Tsinghua's, sorry I'm mispronouncing that, Beijing Tsinghua's Chugang Hospital, it's an affiliated physical hospital. It just opened a large phase 2 expansion with AI guided care. So again, they're expanding in the medical field and they need these robots to give assistance to all the clerks, the hospital staff, especially the doctors and nurses. So, how do you feel about this, everyone? Are you enthusiastic? Are you, feeling excited that this is something that we may be getting in the long run, maybe in a few years? Or do you feel that, the robots should not be in a hospital, that they don't have a place in a hospital? Maybe they shouldn't have those high value or very, strategic problems where they have to work hand in hand with the patients face to face. What is your perspective on this? I think it's a positive move forward. As for the United States, I know that we are many years behind this. We do have increase in technology is increasing very rapidly. However, we still have a lot of departments that we need to fix here. namely, for example, like social services, especially for children in foster care. Um, we need for our, train stations to be equipped. We need our, again, social services where we treat the people who are mentally ill, people who are homeless, to give them resources. We need to have more jobs, more training. Our school systems need to be improved a lot. That's my opinion as well. So please give your feedback, leave a comment below. I think this is an exciting story. I'm fascinated by this. I definitely will be learning more. And please like, share, and subscribe to my channel. Thanks a million. Thank you again for watching, and stay safe wherever you are.